maybe men too, but as a woman, I have felt that to my bone when someone like, looks you up and down or whatever. So we don't have to touch. So it's not the touch per se. It's right. Like what is it when we use our issue again of touch I love how you said it, Stephen, that like what's the balance? It's like anything else. What the benefits weigh in the risks, right? And they're clearly in some with some populations or some settings, there's higher risk and clear prohibitions. Like one of the classic examples is a prison setting versus a hospice setting. One big example that my students, I take a group of students, David is very familiar with this, for a month to Ecuador. We go to Guayaquil to work in with psychiatric patients, and actually the main rotation is in a place with severe mentally ill individuals. And consistently, always, the main shock for our students who got Latino students and everything, but we come from this culture, is how much touch and warmth and within the professional boundaries there is, and there's so much love,
Yeah.
like really expression of love. And one of the things that really we talked for a long time with my students was one time that with the one of the doctors, and everybody walks around with white coats and stuff, it's hospital models and things, giving us an orientation around. And we're standing in the middle of a yard, and there are like 8 of us, two or three of the staff there, and a woman that comes, a little bit of, like clearly severe psychopathology, comes to the doctor and hugs the doctor and asks a question. And the doctor being a psychiatrist, so warm, just for the heck to say, Maria, look at what I have. I have a group of students who are visiting from United States and come to see our system, and kind of like, embraced her back, welcomed her, made her feel welcome, and said, would you give me some time to continue with them and whatever? I'll go check in with them and kind of introduce us to her. But it was just such a reaction for the whole group. It's like that would have never occurred, or people would have been so, or the reaction. Imagine a person like that, especially that are so rejected or isolated from society. How beneficial, right? Is that kind of touch and not touch? And the other thing that I would say that I say to my students always is like, to be inappropriate, I don't need to touch you. I can look at you, I can say, I can, maybe men too, but as a woman, I have felt that to my bone when someone like, looks you up and down or whatever. So we don't have to touch. So it's not the touch per se. It's right. Like what is it when we use our power to do things? And that could be the power of look, of the word, and touch, and we have a, with reasons, but we have shied away from something so beneficial at appropriate times, of course, right? Anyway, but those are kind of like my main points that I would love to hear your perspective, people's, like lay people perspective as maybe clients themselves.
Well,
Yeah.
in the United States, one of the reasons why men don't last long in nursing homes, and what I mean by that is that men don't spend much time in nursing homes because they die, is because they're touched at a far lesser rate than women. There are several articles in nursing journals where nurses went around and observed who was touched and who wasn't in various nursing facilities. And men were touched like, for every one touch for a man, it was like 50 touches to a woman.
Wow.
So, I mean, that's one example of problems with touch. Now, there's the other problem, of course, is how do we, in this society, the United States society, how do we get permission to touch someone? Do we ask permission to give them a hug? If they want
Right.
a hug, do they ask us for permission, and then do we say no? And if we say no, what does that do to our joining?
Yeah.
Right.
Yeah. And one of the challenges, I think, culturally speaking, in American culture is that there's a fusion between touch and sex. That
Exactly.
those two ideas are often one and the same. And one of the things, Stephen, you and I do as sex therapists is actually do work to kind of tear those two ideas apart. Sex is a part of touch, but also helping folks recognize that, hey, like there's that can serve all sorts of functions. It doesn't have to lead to kind of
You're freezing there.
Yeah.
Well,
The person who has the thing is like,
well, I'll just share. This is if you're familiar with Lynn
called in
Hoffman,
this
she was an
morning.
old colleague of mine,
Yeah.
and she was working with a family over the course of several weeks. And at the end of the work, the family was incredibly grateful for all the work that she has done. And the family reached over and said, "Can we give you a hug?" And Lynn Hoffman walked in to give them a hug, and the team called in and said, "Don't do it." And that was for her kind of the shift from the modernist, seeing that the kind of the tyranny of that modernist view that says we know what's right from outside, as
Sure.
opposed to this is something that we can kind of collaborate and negotiate with each person we're with. It's not, there's no predetermined idea about that.
how do you do play therapy with a 3-year-old?
Right.
I mean, if the 3-year-old jumps in your lap when you're playing Legos with them, do you say, "Get off my lap"?
Right.
Right. Or even if you look at Susan Johnson's work, Susan Johnson is always reaching out and touching
Yeah.
many of the clients that she works with. But I noticed, as Stephen was suggesting, she doesn't necessarily touch men in the same way. She's often touching the women.
Well, the gender considerations. I mean, that's a great point, and I would be very interested in getting more information when you were talking about nursing homes, and as we get older, also, and the needs even become more salient in some ways, right? But their gender, there's so many things, right? Like in power, but there's men to men touch is different, women to women.
Right.
There's so many combinations. I mean, like the client factors versus the therapist factors, our therapeutic orientation, like I mentioned, the setting. So I'm interested in more into the nursing home. I never thought about that setting in that way.
Well, another fact about the nursing home business, we talk about aging life care managers is predominantly dominated by women, as opposed to
Yeah.
men being in that field, just like early childhood is predominated by women, kind of educators. And so in some ways, it's how we value. Like in some ways, that value that's placed, it seems like that women can do that, men cannot. And so we devalue
Right.
a lot of those kind of activities. It's just,
Which is a big, serious problem for men
Yeah.
throughout
That's
the
right.
and especially in
Yes.
the United States.
absolutely.
That's right.
This lack of touch at the end of life in a nursing home is not necessarily is parallel to the lack of touch that men have either with each other or with their partners.
Yeah.
Yeah.
So the gender thing is a social construction. I don't believe that men need touch less than women, or
Oh.
they're just trained not to, or to see touch and sex as being something that's too risky for me.
Yeah.
And the breaking through of that, I think sex therapy might have some things to offer here in
Yeah.
terms of the ethics of permission.
Yeah. Portia, what were you going to say?
I think that's so applicable, especially working a lot of my staff who at one point I had male leaning staff and had a lot of male TMs and TTNS. And when we're assigning, you know, I feel like the conversation around touch is very different. But now that I have more female staff and they're being assigned more male children, like find it like the conversations we're having about like how does touch work when I'm working with these kids, like as a woman, and I have a little boy come and hug me, like I find the conversation is more cautious when it comes to male children than female children. But with female children, it's kind of like we don't even have those interactions as much because I think that female children have physical interactions more often with the grander scheme of the people in their lives as opposed to male children, especially when you're working in this field. It's like, oh, wait a minute. If he is this tall and he hugs me this way, and it's like that is so very real. Even when I worked with kids, I was way more cautious when it came to male children and female children because female children they kind of were neither here nor there when it came to that, but male children were more inclined to hug me to say bye. And I'm 5'1" and short, so we're the same height. And so it felt awkward. So, these are the things that I'm seeing. And I literally just had a conversation with the staff this past week about like, what do I do? How do I handle that? They were a nanny, so touch looked very strict and very different. And doing clinical work, it looks very strict and very different in different ways.
Yeah. Phil, what are you working through?
So I'm working through a couple things. So first of all, like it's kind of like going along with what Stephen was saying. I believe in the fact that nurturing. So there's always this idea around like nature versus nurture, right? Like, and you're like, women are more nurturing than men. That's not true. Women nurture different than the way men do, right? Because there's a different essence of nurturing that men bring, right? It just doesn't look the same. It's not about better or worse, but there's value in both. And so that's the idea that really kind of sits with me, because I think about, for example, the relationship I've had with my dad versus the relationship I have with my mom. There's certain things that I've seen him nurture me through that my mom wouldn't do the same way that I would need from him. Now, the second thing is kind of running along with what Portia was saying. As a TM, I've only had one female client, right? And it was controversy getting that client, right? The only thing that actually got me there was the fact that like the clinician on the case was like, no, because you're a black male, and her biggest issue has been around like, how do I learn how to connect well with men? You are safe. And she trusted me. She's a person of color, right? But she trusted me. And I had to also go and trust myself because I knew, I'm a professional. So like, there was something though about like even getting that one client, because the rest, I mean, oh, Phil's here, all the boys, right? That's something that kind of just hit me now. It's like, wow, like I really didn't have that many like female TM clients. I'm really trying to think I only had one, right? And also, and how delicate that was for me, like in terms of, hey, just document and all these other things. And it was like special sit down like conversation, which goes back to this point of, are we too do we when it comes to touch, right? Is it are we too hypersexualized about things? Whereas, like, because there was moments I've had the sessions with this young lady, and like she was crying. She was like a teenager, and she needs a hug, right? But like, am I gonna like feel weird? Like, oh my goodness, like I still gave a hug, but you know what? I gave a hug, and I had to go report, right? I had to be like, okay, by the way, give her a hug. It was and that does feel off, right? Because not every man is this uncontrollable horn dog, and like, if you touch me, like, we're gonna go off. That's how sometimes it feels. Sometimes it comes
But
off
it's
that way.
that's social association, cultural push
Right.
that they're very linked to sex. But body, I mean, you go to Europe and you see flesh photographs, whatever artistic. I mean, here movies. We look at movies where I think better a little bit more. But for example, when do you see in a United States movie someone, let's say, getting up in the morning and walking around their house naked? We only do that and go to the, in our underwear or whatever to get a cup of coffee, whatever. You see that more in European movies. So you see kind of more our nakedness and that kind of flesh is what I mean. In our day to day, when we have the nakedness or the touch, is in a specific setting of sexual setting. And I think, so it's a message and association that we get in all these different ways.
Yeah. Heather, what are you working through?
I'm working through a lot. I appreciate everyone's perspectives. This is a hard topic for me to talk about. I don't know why. I think I'm just having a reaction to what everyone else is saying and thinking about my personal experiences with this, because I think some of my training has made it so, I mean, I'm responsible for how I feel, of course, but I've had a lot of training around how this is just not okay, ever. And that was very early in my training, and I still notice how kind of nervous I am to talk about it and deal with it. And I'm much more on the side of, we're human beings, and if it feels natural to offer a hug, receive a hug, and it feels safe to do that, then do that. And I just appreciate what everyone's offering here, because it sounds like all of you have been in that position too, and have gone for it, so to speak. I'm just recalling a few times where, I mean, termination sessions, I've had clients ask, can I have a hug? And I actually have offered hugs to not just in termination, but clients who are in such distress. They're shaking, they're crying, they are just almost dry heaving in session because they're so sad. And I'll say, or I'll ask, do you want a hug at the end? And the response that I've always gotten is, oh my God, yes, please. And it's not a long, deep embrace, but it is just sort of a natural reaction to want to offer someone something like that in that moment. And then I've had clients, I work with a lot of men in my age range, and none of them have ever asked for a hug. So I'm grateful to have not had to navigate that. But I had one client who, I guess, in his words, was a sex addict. And the only time we ever met in person, he came right in and asked me, or didn't ask, just hugged me. And I was frozen. And it was really uncomfortable. And I didn't address it right then and there in that session. I just kind of thought, we'll address it next time. I only met him in person one other time. And I was going to address it. I was already had the way that I wanted to talk about it. And when he walked in, he walked over to the seat, but then he got up and said, oh, I forgot to hug you. And that's when I said, okay, we need to have a conversation. And I won't go through the whole conversation, but it was very, very uncomfortable what he was saying. Sort of, well, you seem like someone who doesn't want, you seem like a woman who doesn't want to be hugged, is what he said. And there were a lot of things in that conversation that were really uncomfortable. And it was one of those things where I thought, okay, this is where I draw the line with touch forever. And since then, I've become more flexible, but I really try to think about who, what, where, when, to a point that I probably overthink it because of that one experience.
The negative experience.
So I'm kind of all over the place with this because of,
It's
Frozen.
But I think that's it. I'm sorry you had to, experience that and that it has impacted you that way. However, I think that's the appropriate thing to do. It's like what we're saying. It's we have many tools in our in our menu, right? And that's the appropriate thing when to use whatever tool in with whom and when that is of benefit to the client. Because that's another thing. Do I feel that is this on my end? I mean, I tend to kind of more respond, or I hope that that's what I'm doing. That it's not reacting like, oh, I feel like I want to hug because I feel like work. No, it's a dance, right? And as we build our experience, we're also building that this is appropriate. This is with the situation that you explained. I couldn't. I think you handle it beautifully, and I mean it's kind of like that's what we're talking about. Like how do we not just generalize and say to everybody that could benefit? No, but in that situation, absolutely. And
well, and one thing I just want to add to that is I really didn't want this man in particular to feel ashamed. I mean, he already felt,
of course,
really awful about himself for the behaviors that we have been discussing over time. And so it was a moment where I thought, I'm uncomfortable. I don't like this. And I don't want this person to feel worse about themselves and assume that he has some kind of agenda because of his history doesn't mean that there was any intention of that. So it's a lot to manage in a moment. And that's where I think it can get difficult.
Well, one of the things that I was going to say before my computer wicked out is that I noticed in this conversation that we start with touch, but then the conversation kind of moves into one about gender. And then we kind of move back to touch, and then it moves to one about power and imbalances, and then we kind of move back to touch. And then we move into kind of cultural narratives of like bodies and the conservatism about bodies, and we move back to touch. And then there's kind of the centering on abuse and abusive dynamics, and then we kind of move back to bodies. Like it's just been really interesting how we've kind of zoomed in and out of, like, we start with bodies, but true, the issue is about touch. But there's also this like deeper underlying theme that's going on when we're talking about touch. So